Welcome back, everybody. Another episode of Bread and Butter Primary Care. Today we're going to be talking about triglycerides, hypertriglyceridemia, and what to do when that is the number that's the most high, or in some patients it's the only number that's high. So we talked about the standard lipid panel that you get on patients. You're going to have an HDL, a total cholesterol, an LDL, a non-HDL, and then a triglycerides. Every once in a while you'll run into a situation where the numbers look pretty good. They're within, kind of borderline or maybe even below all the goal levels, but the triglycerides are super high. And maybe not super high, but triglycerides are elevated and everything else is okay. And so then oftentimes the question comes up, what do you do in those situations where there's not necessarily a hyperlipidemia problem, but it's mostly just a hypertriglyceridemia, or the triglycerides are the only thing that's high? And it kind of depends on how high they are. So there's a previous video where we talked about what triglycerides are and why they matter. And triglycerides can cause two main problems. The main thing triglycerides do is the same as the LDL. If you have an excess of triglycerides, they coat the artery walls and increase your risk of heart attacks and strokes. And so that's one thing that you can be treating when you're treating a triglyceride number. The other thing they can do is cause pancreatitis. Now, pancreatitis because of triglycerides usually doesn't happen unless it's very high, usually over 800. For some reason, I was reading earlier today, 885 seems to be the cutoff where you get into the risk of having pancreatitis because of your triglyceride levels. And so what you do to treat triglycerides kind of depends on, well, what are you worried about? Are you worried about triglycerides causing increased risk of heart attack and strokes and heart disease because of the lining the arteries problem, or are you worried about preventing pancreatitis in patients with extremely high triglycerides? If the answer is that you're worried about just the overall lowering the heart disease risk, then it's just statin therapy. So you want the lifestyle management and you want to use the statin therapy to help to lower the cholesterol overall, and you oftentimes do get a lowering of the triglycerides. Again, diet is very important for triglyceride management, and so that's another thing that can help patients a lot. And so generally speaking, you can use the statin medications if that's what you're shooting for. If you are getting to a point where you're trying to lower the triglycerides because you're concerned about pancreatitis, triglycerides above 800, above 885, there are medications that are more targeted to triglycerides, and those are usually, there's Zetia and then the fibrates, fenofibrate and gemfibrozil. And those target the triglycerides more specifically. The problem with these medications is they have a lot of side effects, and very commonly people have the side effects. A lot of flushing in the face, kind of hot flashes type of things. They can be quite uncomfortable to take. They can cause some GI upset. And so most of the patients I've had who have been on fibrates or triglyceride medications do have some level of side effects. And so they're very difficult to tolerate. And so if you're looking at triglyceride numbers above 150 but below 800, chances are you're fine just doing statin therapy like you would for any other high cholesterol patient. If you've got triglycerides clear above the 800s, 885 and higher, then it might be worth doing something with a fibrate or a Zetia or something to help kind of bring that down. And again, remember, diet is huge with triglycerides, and so that can be a big part of that. So I have run into the thing where you have patients come in and they had a lipid panel and they had elevated cholesterol, elevated LDL, and they also have a very high triglyceride, let's say 300, 400, and they're on a statin and as well as a fibrate. And you read the previous note, it says, given the high triglycerides, that they started a fibrate medication. And the patient's having hot flashes and GI upset and all that kind of stuff. Generally speaking, the most current recommendations would say that the risk oftentimes isn't worth the benefit of those medications. There's not extremely good evidence that lowering the triglycerides with the fibrate makes a huge difference in the heart health, preventing heart disease. There's certainly good evidence that statin therapy does reduce the heart disease problems. And so when you're looking at patients who you want to lower the heart risk and stuff, statin is still your main treatment, even if it is a triglycerides. If they're very high, above the 900 mark, and you want to prevent pancreatitis, then it's probably reasonable to look at something that targets the triglycerides more specifically. So there's just a short talk about what to do when the triglycerides are really high, or if you have an isolated hypertriglyceridemia where the numbers are good and the triglycerides are the only thing up. You're still looking at a statin unless, again, it's above that 885 mark. So that's a little brief message on triglyceride treatment. I hope it's helpful in some way, and that you guys have an enjoyable day.